Ever wondered what a spinal fusion is? Well, let's unravel this mystery together. Spinal fusion is a surgical procedure that involves joining or fusing two or more vertebrae in your spine. Think of it like welding in the body's internal structure. This is done to eliminate the motion between them, thereby reducing the pain caused by movement. The idea is simple. If the painful spine segments don't move, they should not hurt. Now, how is it done? Surgeons use bone grafts, often sourced from the patient's own hip or from a bone bank, to promote growth between the vertebrae. These grafts eventually heal to create a single, solid bone. Remember, spinal fusion is generally considered a last resort, reserved for severe back problems that haven't responded to other forms of treatment. So that's what spinal fusion is, but who might need this procedure? Stick around as we dive into that next. So who are the candidates for a spinal fusion? Well, that's a great question. Spinal fusion primarily caters to individuals who've been grappling with severe, relentless back pain that hasn't seen any improvements with other treatments. Now, you might be wondering, what conditions could lead to such a state? Let's walk through a few. Degenerative disc disease is a common culprit, where the discs between your spinal vertebrae wear down over time. Spinal stenosis, where the spinal canal narrows and presses on the nerves, can also be a reason. Then we have conditions like scoliosis, a curvature of the spine, or spondylolisthesis, where one vertebra slips over another. In some cases, spinal fractures or tumors might necessitate a spinal fusion too. In essence, it's a procedure sought after when the back pain becomes too much to bear, and other treatments have been exhausted. Now that we know who might need a spinal fusion, let's delve into the risks involved. Like any surgical procedure, spinal fusion comes with its own set of risks. Now, it's important to remember that risks are inherent to any kind of surgery, but when it comes to spinal fusion, there are a few specific ones we need to consider. Firstly, there's the risk of infection. This is something that can happen with any surgical procedure, but it's particularly concerning when we're dealing with the spine. Infections can lead to further complications, and in some cases may require additional surgeries to treat. Another risk factor is nerve damage. During the spinal fusion procedure, there's a possibility that the nerves around the spine can be damaged. This can lead to a range of problems, such as pain, numbness, or even paralysis in severe cases. Blood clots are also a potential risk. These can form in the legs during or after the surgery, and if they travel to the lungs, they can cause a life-threatening condition known as a pulmonary embolism. Furthermore, there's also the risk of pseudarthrosis, a fancy term for when the fusion doesn't heal properly. This can lead to ongoing pain and may require further surgery to correct. And lastly, there's the risk of adjacent segment disease. This is a condition where the discs above or below the fusion site start to degenerate more quickly than they would naturally. This can lead to additional pain and may require further surgery. It's also worth mentioning that some people may be at a higher risk than others. For example, people who smoke, those with certain medical conditions like diabetes or obesity, and people over the age of 65 are all considered to be at a higher risk for complications. Now, this might all sound a bit daunting, but remember, these are potential risks. They don't happen in every case, and your surgeon will always weigh up the potential benefits of the surgery against these risks before deciding to go ahead. Given these risks, one might wonder about the success rate of spinal fusion. Despite the risks, many spinal fusions are successful. But what does successful actually mean in this context? Well, to understand this, we must first define what success entails when it comes to spinal fusions. Typically, a successful spinal fusion is one that achieves three main objectives. First, it results in a significant reduction of the patient's pain. This is, after all, one of the primary reasons why someone would undergo such a procedure. Second, a successful spinal fusion leads to improved mobility. This means that the patient can move more freely and with less discomfort than before the surgery. Lastly, and perhaps most importantly, a successful spinal fusion allows the patient to return to their normal activities. This includes everything from day-to-day tasks to recreational pursuits. So when we talk about the success rate of spinal fusions, we're referring to the percentage of patients who achieve these outcomes. Success is good, but recovery is equally important. How long does it take to fully recover from a spinal fusion? Recovering from a spinal fusion is a process that requires time and patience. But let's break it down a bit. The journey to recovery after a spinal fusion surgery is often a two-part process. The initial recovery period, which typically takes place in the hospital, is usually relatively quick. In most cases, patients are up and moving around within 1 to 3 days following the procedure. During this stage, the focus is primarily on pain management and gradual reintroduction to movement. But the journey doesn't end there. The full recovery timeline can extend several months to a year, or sometimes even longer. This is when the body works on the fusion part of the spinal fusion. This means that the bone graft placed during the surgery is gradually incorporated into your spine. This fusion process is what provides the long-term stability and pain relief. Now, while this might sound like a long time, remember that every person's body heals at a different pace. Some might find that they're feeling back to normal in just a few months, while others may need a full year to regain their pre-surgery strength and flexibility. During this time, it's crucial to follow your doctor's instructions and to engage in regular physical therapy. Physical therapy is an essential part of recovery, helping to strengthen the muscles around the spine and improve flexibility and mobility. And remember, it's okay to take it slow. It's better to let your body heal at its own pace than to rush the process and risk complications. It's also important to listen to your body. If something doesn't feel right, don't hesitate to reach out to your healthcare provider. Let's not forget the ultimate goal of this surgery is to reduce pain and improve quality of life. Yes, it's a significant procedure, and yes, the recovery process is lengthy. But for many, the end result is a life with less pain and more mobility. So, while spinal fusion is a serious procedure, it can provide relief for those suffering from severe back pain.